the break, I mean, how many people we know that like can't jump or sneeze or cough without having a little bit of an accident, and they think it's kind of normal, and it's not.
Yes, it's common, but it's not normal.
Okay.
That's the distinction. It is something that happens to a lot of people, so we want to destigmatize that, but it is something we treat in pelvic floor therapy as well.
1 in 4? Is it
I think that's the statistic. 1 in 4 women over 20
over 20 has a pelvic
experiencing.
floor disorder? What is a pelvic floor disorder?
So the pelvic floor is a group of muscles that sits at the base of the pelvis, and it provides largely support and stability to any of the abdominal contents, the hips, the pelvis, and anything in that region. It also aids in function of reproductive organs, the bowels and the bladder. So dysfunction can look like a lot of different things. You can have pain, you can have tension, you can have heaviness, you might have dysfunction, whether that's sexually with bowel or bladder movements. And we have a wide range of things that we'll treat.
Okay, this may be a dumb question, but do men have pelvic floors too?
They do.
Okay, so do they have disorders too, but even though they don't have that much trauma unnecessarily down there?
Yeah, so there's certain conditions we'll see more in women because they're related to their reproductive organs, but men can definitely have pelvic floor disorders, and we treat those as well.
So there are exercises that we can do to kind of strengthen that area and shore it up and literally like shore it up to make sure we don't have these problems?
Yes, the common one people think of is the Kegel, but we have better ways to strengthen the pelvic floor.
Oh, thank goodness.
Because ideally the pelvic floor should kick in on its own. We don't have to necessarily engage it. There is a time and a place to use Kegels, but a lot of our exercises start off looking similar to like a Pilates exercise, but we'll cue the pelvic region a little bit more. And they involve deep core stabilization because you want that coordination with the core muscles and the pelvic floor muscles.
Okay, so show us a couple.
I can show you a couple.
Okay, great.
So some that will help stimulate the deep core will be in this supine position, and this is an example of one. You can have your legs in a tabletop position, and on your exhale, you're going to create an abdominal brace here by drawing your belly button towards your spine, and then you would lower to tap one heel down and bring it back up. So you can do that on your exhale, inhale as you bring it back up. There's a few varieties here, and then you can progress it there as well. So that is one that people might recognize from
That'll get rid of that
I say that's going to also help the summer bod.
It's definitely a good core one. And then another one that helps turn on the core muscles can be in the prone position. So depending on how you like to do your exercises, there's some variety there. A lot of people do planks, but I really like a tabletop position for pelvic health with just a little knee hover here because it'll stimulate those lower abdominals and you'll feel those fire up right away. And then to make this one harder, you can add some shoulder taps, you can add some movement, and you want to keep the hips nice and stable while you're doing that.
How many of those are you doing, and for how long and how often?
Depends on the case, but I'd say typically for something a little more high level, like the second one, I'd start with maybe 10 repetitions, see how it goes. Find the patient's point of fatigue, and then we'll kind of base the reps off of that.
I know you're engaging your core muscles. Can you feel when you're engaging your pelvic floor as well?
You can if you're doing it intentionally. We don't necessarily need to feel that engagement all the time to know that we're strengthening it.
And so you say we don't always have to get on the floor. We can stand and do some?
There are definitely, so like any like weightlifting exercise can be a pelvic floor exercise. You can do all of that stuff standing as well. And we just focus on the coordination that we practice on the mat. So we can progressively overload patients that way. It's important to note there's a lot of relaxation that goes into pelvic floor therapy as well, because a lot of people come in with tension in their pelvic floor. So before we even do strengthening, we're often teaching breath work and relaxation and stretching of the pelvic floor muscles. So if you guys want to do a breathing one, we can go over diaphragmatic breathing. So one hand on your belly, one on your chest. And for a diaphragmatic breath, when you take your inhale, you don't want this hand to rise. You want the hand on your belly to kind of rise forward. And you don't want to push it out. Just let the air kind of go low and let that hand on your belly kind of expand forward. And that will help relax and lengthen those pelvic floor muscles. So I will have patients do that for like 2 minutes straight just to get their body in that relaxed state, because it actually helps with activation if you come from a more lengthened position too.
Wow, thank you so much. We appreciate it. There's a lot more information out there, so make sure you visit thepelvicinstitute.com.